All right. Good morning, everyone. This is Patti Goolsby coming to you from Denver, Colorado metro area, Pro 6 in the Denver metro area. Thank you guys so much for joining us each and every Friday. We are super excited this morning. But first, we just want to welcome you and share with you this Zoom every Friday that we put on is a cross-culture Zoom. We love it when you get on and share this out to your teams. It's always a great place for education. So we're excited this morning. Two things this call represents for us is a culture is strong when people work with each other for each other, and a culture is weak when people work against each other for themselves. And the second one that is my absolute favorite, I just saw it the other day again, and it's a culture eats strategy for breakfast every time. And our culture is amazing, and it comes from the top down. So I am really excited to introduce the brainchild of this entire call, and that is Pro 6, Shannon Shine, out of the Denver metro area as well. Shannon, take it away.
Thank you so much, Patti. And yes, we have so much fun bringing you this call and are super excited for today's speaker. We heard her on a call the other Monday, on Carrie Dickey's Monday call, and her energy and everything is just over the top. Let me tell you a little bit about Julia. Julia Mills lives in Raleigh, North Carolina. She's a new Pro 5 and recently attended the Pro 5 Summit. Woo! Congratulations. She and her husband Chris are from Michigan, so born and raised Midwesterners. They're blessed with two amazing daughters, Kathleen, 23, and Leah, 20. Julia has a master's degree in teaching and technology. She worked 10 years as a teacher and technology specialist and then moved to the pharmaceutical industry where she spent 10 years as a pharma rep with two global companies. In 2013, she made the decision to work for herself and has since then served as a healthcare business consultant to physicians and startup medtech companies. She's been with LifeVantage since 2014 and feels that LifeVantage was divinely placed in her life 2 times. We're excited for you to share that with us, Julia. So please, Julia, take it away.
Thank you. I meet the most amazing people at LifeVantage, and I don't know hardly any of you, and hope to get to know you all really soon, even more. Definitely will be at Global, so we'll see you there. Thank you, Shannon. Thank you, Patti. I was on the Carrie's call because I was able to go to the Pro 5 Summit, which was a goal that I had this year, and it was truly incredible. So if you haven't been, put it on your list right now and make it a goal. Get there. It's going to be coming up, in 2019, I think February maybe, but definitely go. I mean, I have been in teaching, as Shannon said, for 10 years. And I went into teaching because being a mom is the most important thing to me. I was raised by a strong single mother and was pre-med to start. Medicine has always been my love, but being a mother is the most important job that I do. So I decided to become a teacher and did that for 10 years so that I could have a more flexible schedule with my children. And it was great. I mean, I really think that the strength of the family is the strength of our society. I think that it's really something that I'm going to start to use more and more as I'm talking to people, because I do think my bachelor's is early childhood education. So I spend a lot of time learning about, what we learn between the ages of 0 and 5 and the importance of all of that. And it really truly forms us, who we are. So if we can get more moms and dads to be able to stay at home or at least have time to be with their children, be present, I just think the world would be a much better place. So I did that for 10 years and really liked it. But I've always been, you could say I'm a little ADD. My friends are like, Julie, what do you do? I mean, I love to learn. And so, teaching was really good because I love to teach. But I'm always learning something new. So in college, I was pre-med and then I went into business, actually. I love business and did that for 3 years, but then thought, well, geez, how am I going to be a mom and be a business person? How am I going to be a mom and a doctor? So I went into teaching. And then I got a master's in technology because technology was really starting to advance and I was really interested in that. So I've always been kind of a really early adopter of technology, which kind of leads me, I think, to LifeVantage, and why LifeVantage is just such a perfect fit for me, because it is the science, it is the teaching, it's the healing, And it's the business, it's giving ourselves, a chance to have a business asset for our family and the future of our family. So my story, I guess I'll start with how I first found LifeVantage. As Shannon said, I found it 2 times, and my story is kind of crazy. And I'll try to keep it as concise as possible, but I don't want to leave out any key points, because if there's something that resonates with someone that helps them, that's what I really want to do, right? This isn't about me. I'm just going to share my story, and maybe there's something that can help you or help somebody else. So I was a teacher. I left teaching. My husband and I started a business. He was in the automotive design industry, and it was very technology based. So we did that together for 3 years, right around 9/11 hit. And so we had invested heavily into property, put all of our eggs in that basket, and we were excited. Things are doing well. We had this business, and then 9/11 hit, and then the automotive markets went bankrupt. And so we both lost our jobs within 3 months. And then we lost our property and our investment. So basically had no home, no jobs, and thought, oh my gosh, what are we going to do? So I called up my cousin who was in pharmaceutical sales, and I said, you know what, my first love is medicine. So do you think I can do this? She said, do it, check it out. So I applied. There were 1,000 applicants. There was one job. I got the job. I believe my life has been blessed in many ways. It's not me. It's just kind of, I think, God putting me in certain places. So I got that job, which was helpful for the family, and did it for 10 years. 2 global companies, rose to the top of those companies because I brought in education. I didn't consider myself really a salesperson. I loved what physicians did. I think it's one of the most honorable professions. So I wanted to educate them. And all we knew was drugs, right? Pharmaceutical drugs help you. Surgeries help you. So I did that. But over time, I started to, like 2008, I started to see that really after, the Obamacare has changed a lot. The insurance companies and the pharmaceutical companies really dictated what patients received. Doctors, really, hands were tied, not a lot of control. Patients were getting sicker. They were being hospitalized because the insurance companies were telling doctors what they could and couldn't write. So we both, me and the physicians just kind of tried to help each other through this, and so it was kind of shocking to me. I believed at that time that the pharmaceutical company was telling me the right information. You look back and we're learning a lot about money-driven industries and patients at the expense, really. So I learned a lot through that. But in 2009, in December, even though I was had just received a promotion the year before and doing really well, I was downsized, so lost my job. So I thought to myself right away, okay, at my age, this industry, I said, I'm not going to go back into pharmaceutical sales. I got to figure something out. I got to reinvent myself again. So I got online and I thought, okay, what's out there right now? And I came across LifeVantage in December 2009. So they had just pulled the products, as you know, from the stores and were shifting into direct sales. So I found LifeVantage online. I called the company and I said, I looked at the 3 studies. At that time, they had 3 studies. I said, this is remarkable. How come? I was kind of mad, honestly. And I think a lot of people are kind of angry when they see the ABC primetime and they see the studies. And my first question was, how come I have never heard of the words oxidative stress? Okay. We've been trying to help people with their health, and I've never heard of this in all my years, nor had I heard of PubMed.gov, interestingly enough. Everything's kind of fed from the pharmaceutical. Here's the studies. This is what we want you to see. It's crazy. So I called the company and I said, this is amazing. I really want to know what this is. I'd like to be a part of it. So, and I'm thinking it's a global company. I'm coming from corporate. All I knew was corporate. I'd never heard of network marketing in my life. Coming from Michigan, I heard of Amway, but I didn't really know what it was. So I was put in touch with the team here in North Carolina, just getting things off the ground. Met with them. They said, listen, have a house party, invite all your family and friends, get people in. Okay, I will. This is exciting. Lost, a 6-figure income, car, everything. My kids are in Catholic school. We want to keep them there. I need to replace my income. I'm kind of thinking that's what this is. good at sharing information. This is amazing information that everybody needs to know about. So I get the meeting in the house, and a friend raises her hand, one that I really, really highly respected. She and her husband were very, very successful, and her husband in the pharmaceutical industry. So when she raised her hand and she said, it sounds like a pyramid scheme, it kind of was like a slap in the face. I thought, wait a minute, this is really important information. What is that? So that gave me a fear. And what I want everyone to know, and what I'm trying to teach people as I'm reaching out to people, or people are looking for a business opportunity and they hear that this is network marketing, I just want them to ask the right questions, because I didn't ask the questions. I didn't ask them. I kept with it for about 13 weeks. I had 13 weeks of severance pay, and I thought, okay, let's make this happen. I got 13 weeks. So I shared it with a bunch of doctors, and they looked at me like I was a little crazy. And so I let it go. Okay, that's the story. Regret it completely. And one of the biggest regrets I have is my father was sick my whole life. So when I was growing up, he had addiction to alcohol. He was diagnosed with mental illness, was hospitalized much of my childhood. And it's something I always wanted to help him. And so when I found Protandim in 2009, I let it go. I didn't come back to it, and I'll tell you about that until end of 2013, again, December, so really 2014. And my dad had passed away in 2012. So I missed the opportunity to help him. Try not to cry.
Julie, you're
I
awesome.
don't want it to happen to anyone else.
Right.
So I went to work, traditional. Let that go. I went to work for a medical device company where we helped put sales teams together. And so I thought, well, let me learn that aspect of business, right? Let me learn the other side of it. So I did that for 3 years, made a lot of connections, learned a lot, helped bring that company up to a very high level, and then was let go again. So it was at that time, that's when I said, I'm never going to work for anyone else again. I just made the decision. And luckily, my husband was very supportive. I took some time off. I was sick as well with Hashimoto's. If anyone knows about autoimmune hypothyroidism, I had suffered from that my whole life, which I really think is probably what my dad had as well. But it was not diagnosed at all. So when I had lost that second job, it was really, really tough. I'd lost my dad that year. I'd lost 4 other people due to chronic illness. Had kind of become a surrogate mother to a few of my daughter's friends who had lost their mothers due to cancer, suicide, just horrible things. And so I took time off and decided never going to work for anyone else again but myself. And divinely inspired, I guess, provided. I started to I said, okay, I'm going to become a consultant. I have a lot of connections. I know how to bring a product to market. I know what to look for in the market and healthcare space. I understand physicians and how they operate. So I started to work for a small little startup company. And we were looking to put together a digital app for women suffering from depression and anxiety. And I thought, oh, that's really interesting. So that product led me to a doctor, and her name is Dr. Kimmel. She was a neurologist that I used to call on here in Raleigh. And she was I kind of went to her office because she was very objective. And I wanted to get some objective physician feedback on this product. So I went to her office and hadn't seen her for 5 years, walked in, made an appointment. She let me back. We sat down. I showed the product. She gave me some feedback, was very objective as she always was. And then she looked at me and she said, where do you want to be in 5 years? And I said, I want to be with my family. I want to be self-sustaining with my family, doing yoga, doing the things that make me happy. And she said, well, I have something for you. I think you should check it out. I said, okay. that'd be okay. Interesting. So I went home and I said, Chris, it's weird. This doctor says she has something for me. And he's like, oh God, if it's kind of what it was before, let's just kind of stay away. And I said, well, okay. I just want to be open though. So I went back to her office to her meeting. I walk in and she said, and she was so excited. She said, Julie, it's Protandim. And I went, wait a minute. I know about Protandim, but geez, I hadn't even thought about it, you guys, since 2009, 2010. It was out of my mind. Hadn't heard about it, nothing. And I said, wait a minute. I know about Protandim, but that was like a long time ago. What's going on now? And here's the weird thing. I had forgotten that I had given her information on it in 2010. Totally forgot. She forgot too. She put it in her closet, didn't even look at it. So she showed it to me. She told me about the Tecfidera study. She said at that time they had 16 studies. At that they're now, I think at that point they were $150 million and expanding. And I went, oh, I knew it. And so I joined right away. Well, didn't join right away. My husband and I went to a meeting. Thank God above, really, that Dr. Gordon flew to Raleigh to present. Because had I not gotten that validation, and my husband not gotten that validation, I don't think that I would have been here. And I can't imagine my life without LifeVantage and our products and how we're helping people. So anyway, he came, Dr. Gordon, we sat for another hour afterwards, drilled him with questions. My husband and I enrolled, but we really only took the products. I didn't expect, okay, here's the study. If you guys don't know the study, you have to see the study, right? The oxidative stress in health and disease, the potential of NRF2 activation with the gene study. When I saw that, I saw that and I said, all right, I have to be on this for life. Everyone I know and love has got to be on this. If we can turn off the genes in heart disease, colon cancer, and Alzheimer's, please, we need it. Everybody needs it. So I wasn't expecting to have results with the product at all. I felt kind of healthy, even though I was sick really my whole life too, but no doctor had ever pinpointed it. Just lived through it. So I thought, okay, so we got on it. My husband and I got on the products after 30 days. Okay, I had been on a prescription sleep medication. I sold Ambien. And by the way, when you look at the package insert, the way that the drug companies present their data, it says it's non-addictive. I told you my dad was addicted to alcohol. I was always very cautious about that. It says it's non-addictive. I started taking Ambien due to frozen shoulder, menopause, all these things, couldn't sleep. So I was on it every day for 3 years. Yeah, I became dependent on it, even though the package insert says it's not addictive. So after 30 days on Protandim, I was able to get off Ambien and a prescription anxiety medication as well. Thank you, Stephen. 30 days, didn't expect it at all. I just kind of woke up one day and went, I don't need it anymore. I'm sleeping like a baby. I have energy. I'm feeling balanced. My body feels so much better. In addition, probably 2 months in, I had a knee injury, skiing knee injury. I couldn't bend my knee. I couldn't sit like cross-legged. It was really starting to hurt. That was gone after 2 months. So that happened. My husband had a football injury with his knee. Same thing was happening to him. And again, I wasn't expecting anything. And then skin cancer. I have skin cancer. I don't know if you can see, but I'm Irish. I got freckles all over the place. I've had basal cell and squamous cell carcinoma, burned off, cut out numerous times. So having started Protandim and True Science, so I'd go in every 3 months and he'd burn something off or cut something out, and it was painful. I hated it. And we have melanoma in the family, and I don't want melanoma. And, Louisiana State University studies are incredible. So anyway, since then I've had nothing cut out or burned off in now probably going on 4 years. So I'm thankful for that. Let's see. So there you go. So now I love this job. I work full-time still. I still work full-time for a dear friend and wonderful man. If you don't know him, Dr. Life, came into my downline through another mutual physician friend. So he and I just clicked. And so he hired me as his clinical coordinator. So I do a lot with Dr. Life full-time. We travel the United States. We speak. He's speaking at an event in San Diego. We're sponsoring a booth for LifeVantage And yeah, so that's exciting, but I'm excited for LifeVantage, and I have goals. I'm putting it out there right now. Pro 6 by Christmas, Pro 7 by my birthday next year, June 28th. And I'm here for the long haul.
I love
it. Shannon, go ahead. I know I've got a page of notes. I've got people texting, so you go ahead and start.
Yeah, okay, thank you. Hey, Julia, so one of my first questions is you were a pharmaceutical rep, you were trained in that. Talk to us about how this was herbs versus prescriptions. Is it because you're a student of life that you were open to it, or why did you embrace this? What caused you to embrace it?
I'm data driven. It's just data. Okay, so all I had to do was read the studies. I saw ABC Primetime, learned about oxidative stress, read the studies. When I was in the pharmaceutical industry, because of my teaching background and because of my love of science, I'm a geek, I would train other reps on the science. Okay, here's the product. They would understand the product, but here's the science behind it. There was nothing that compared that I had ever seen in the pharmaceutical drug world that compared to what Protandim was. 5 herbs activating the body to heal itself to reduce oxidative stress by 40% in 30 days, the root cause of every chronic disease. It was a complete shift, but it goes, so for me, I was open to it. I guess, Shannon, that's a good question because I understood data and science. I was really confused that I had never heard of PubMed.gov before. And I thought, this is where we should be going for all of our science. Oh, light bulb. But as a child, for me, here's a weird, maybe it's weird, but it's my story. In church, we'd learn about Jesus healing through herbs, natural methods, and belief, right? Faith. And so I always believed, because I was taught, we're made in the image and likeness of our Creator. And I always felt that we had what we needed to be whole and healthy. And so the more I learned about the pharmaceutical industry being toxic and synthetic versus healthy and whole and herbal and plant-based, I just started to learn, and very excited to have been taught by a lot of wonderful leaders at LifeVantage. I mean, truly, Dr. Gordon, I've learned so much from him. Dr. Kimmel, who enrolled me as a neurologist, she started to share this with her patients and offer them a plant-based product or a drug. Which would you like to start with? And she was finding amazing results. So it's funny to try to educate people in a way. I mean, I just kind of want to, it's hard because you wanted to say from the rooftop, like, hello, but you have to start people from where they're at. You can't jump them way ahead, and you just got to kind of help them figure it out. It's been the most difficult thing I've had to do.
When people don't embrace it immediately. I get it. Patti?
Yeah.
Yes.
Okay, so I have a lot of notes. You've covered a lot, but there's 2 things I want to jump back to. How did you overcome the fear of MLM? And then second, I would really like you to paint the picture of what the Pro 5 Summit looks like.
Sure. Oh, how did I overcome the MLM? It's the people at LifeVantage. I mean, it's our company and our culture. Look at all of you. It's getting to know the company and the people. And I've just learned so much. I mean, here's the book that I have, Carrie Dickey's book. The people in this company, and maybe other network marketing companies are different. I mean, I'll never go to another. I mean, this is my home. So to me, it's not network marketing. I guess that's what it is, right? It's network marketing. It's sharing the gift of health. And for people who want a business asset like I did and needed, it's that too. So I just look at it that way. And if people can't see beyond that, I'm going to try to be better at helping them ask the right questions, because I've been there and was afraid because I didn't know. But you have to go to events, you have to go to conferences, you have to learn. I remember my first conference, so it wasn't until San Antonio did I go to my first conference. And that was like 9 or 10 months after I had enrolled. So I really was just a customer for really a long time. And then I spent too long with certain distributors that really didn't get me anywhere. So I'm learning a lot, how to look for the people that really kind of get it. So I don't spend my time trying to convince somebody, or I'd rather lock arms and move. Okay. So I'm learning a lot. But when I went to that first event, Eric Albertson spoke. And oh my gosh, I mean, I'd been in traditional corporate, nobody talks about their feelings. Nobody talks about their story. Nobody talks about their why. And he's up there and I have tears streaming down my face because our family has been through a lot of difficult things. And so had his. And so I went up to him afterwards. I just went right up front and I said, oh my gosh, like, how do you have the courage to share that from stage in front of 5,000 people? And our company is amazing. He just said, listen, it's your turn now. Here are my notes. He gave me his notes from his talk, handwritten. And he said, these are for you. So I talked with him for a long time. And that really was probably the turning point, I would say. Obviously, we all have to go to these conferences and events. If you don't go, you're really limiting yourself and your ability to help other people. And the Pro 5 Summit. Oh, geez. Amazing. You guys go. You fly in, they fly you. They take care of everything. They treat you so well. They pick you up at the airport. They're there for you. Again, the whole thing about servant leadership, it starts from the top, like you said, Patti. Servant leadership from the top of our company down. That's all it was. The entire corporate staff was there. Everybody in their shorts, their T-shirts, their kids, their flip-flops. Darren Jensen's on the bus behind me going to the whitewater rafting. He's putt-putt golfing. Ryan Godwin, just you have access to everybody. Gabe Pearson and I talked for probably an hour. It's a beautiful location. The summit, they take you up to the summit, Pro 5 Summit. I didn't put that together until I got there. I'm like, oh yeah, it's summit. We're at a mountain. You take a gondola 8,000 feet and they rent out an entire restaurant above the world. I mean, it's incredible. And just the feeling, everybody is, what I loved about Pro 5 Summit, okay, versus what I've experienced prior to with LifeVantage, is you have a group of people who are kind of at the same place as you are, and they're all there to help each other. You're learning from people who have been successful and are committed to moving it forward. And in the company, corporate staff, their goal at Pro 5 Summit is to get you to the elite ranks. So it's just unbelievable to me that a company will do this for me and it's my business. It's amazing.
So true. So true. And how no place but network marketing are we poured into, and everyone helps each other.
Yeah.
Julia, I think you've created an amazing vision for everyone from, I wrote down a couple of things that you said initially. The strength of the family, I think I wrote this down, is the most important. So when you create the vision of, this isn't a job, but what you can do, how you can change not only your life, but so many other people's lives when we share what we have to offer with them. I love the vision that you've created, and I think that's so important when we talk to people.
Yay, Shannon, I'm glad you mentioned that because it's something I've been working on, is creating the vision. That's another thing that Gabe Pearson taught, is that's really what we have to do, is create the vision. It's not so much, and I'm a very fact-based person, like I said, data, and I can get caught up. I got caught up for 2 years. I seriously spent probably a year just researching. I have studies. I actually facilitated the Duke ALS study, the one that's on PubMed, just because I love this stuff. But not everybody cares, right? People care about vision. People care about what they can do to change their life, what they can do to help their family, loved ones. And this can do that for them. I mean, my why is to retire my husband from his corporate job, which has downsized. They had 40 in the department. Now I think they have maybe 6. And he's an amazing man, but he can only take so much. It's really not serving him well or his talents. And I'm driven to give him options that he deserves.
Wow. Julia, I love your story. I've got so many notes. I mean, you probably could teach forever on us. We've gotten a lot of notes from people just saying, thank you so much, hugs, that you see now what you have your hands on. We see what we have our hands on, and there's a reason that we've been chosen to share the story, because that's the most important thing. There's a story here, and you're sharing it, and from your heart is absolutely beautiful. So I want to thank you, Shannon. Julia, I can't wait to see you. I'm going to give you a big old hug.
You too.
Close us out.
Yeah, Julia, thank you. I can't believe the half an hour is already gone. So thank you so much for everything that you've shared with us. And you guys listen again and share this out, because Julia gave us a lot of, facts about as the pharma rep and her passion for science. But again, the vision and how we can have people live better lives by bringing them home and sharing with each other how we're supposed to. Thank you so much, Julia, for everything you've shared with us this morning.
Thank you guys. I just love y'all. Really have a blessed day, and go out there and help somebody.
Absolutely. Thank you.
Yep.
We'll send out the recording.
All right.
See you guys next Friday.
Let me know. I want to be a part of these. Okay.
Okay. We'll do. Thank you, Julia.
You're welcome. Thank you.